Hello everyone, welcome to episode 1 of our NEET PG Rapid Recall series. In this episode, we are covering upper limb nerve injuries, a topic from which there will be at least one MCQ every year. So stay focused and let's get started. So first of all, what are the major upper limb nerve injuries? We have mainly four important nerve injuries. They are Erb's palsy, Klumpke's palsy, radial nerve injury and median nerve injury. Let's start with Erb's palsy. So what is Erb's palsy? It is an injury to the upper trunk of the brachial plexus at the level of C5 and C6 roots. So, what causes the Erb's palsy? The causes of the Erb's palsy are falling on shoulder. It means someone falling with a stretched arm or a shoulder, and can be due to birth trauma like shoulder dystocia, a condition in which newborn's hand gets stuck in the maternal pelvis. And next, clinical picture or the presentation, how Erb's palsy can be seen. It is the most important point we have to remember. Many exam questions were based on this clinical picture particularly. A classical feature of the Erb's palsy is waiter's tip, also called as porter's tip or policeman tips. There are many names like policeman tip or porter's tip or waiter's tip, it can be called, which looks like this, in which the arm is adducted and medially rotated or internally rotated, we can say, and elbow is extended, forearm is pronated, and wrist is flexed. We have to remember these characteristics. Next, let's talk about which muscles are affected in Erb's palsy and which function was lost because of it. First of all, deltoid muscle. When deltoid muscle is affected, then there is a loss of abduction of arm. That is why in clinical picture we see adduction of arm in Erb's palsy. It is because when deltoid muscle is affected, then loss of abduction, so it leads to adduction of arm. The next muscles are infraspinatus and teres minor. When these two muscles are affected, there is a loss of external rotation of arm. That is why in clinical picture of Erb's palsy, we saw just now that the arm is medially rotated or internally rotated. And when injury to biceps and brachialis happens, there is a loss of elbow flexion and forearm supination. That is why in case of Erb's palsy, we see elbow is extended and forearm is pronated. I think everything is clear till this point. And there are two important reflexes that are lost in case of Erb's palsy. These are biceps reflex and supinator reflex. And next we have Klumpke's palsy. So Klumpke's palsy is an injury to the lower trunk of brachial plexus at a level of C8 and T1 roots. And what are the causes of it? So overstretching of an arm, grabbing something during falling from height. And the most common cause of Klumpke's palsy is pulling hand of the baby during vaginal delivery. And what are the clinical picture of the Klumpke's palsy? So it depends on the site of injury. If ulnar nerve is damaged, then it is characterized by claw's hand, which is due to paralysis of the intrinsic muscles of hand, and it looks like this. We can see in the picture that the ring finger and the pinky finger are flexed and gives a characteristic claw hand feature. And if there is a damage to sympathetic fibers at T1 root level, and it leads to Horner syndrome. It is nothing but a syndrome characterized by a classical triad of symptoms, which are ptosis, meiosis, and hydrosis. Ptosis means a drooping of the upper eyelid. You can see in the picture that the eyelid was falling down. Meiosis, which is a constriction of the pupil, and anhydrosis. It means inability to sweat normally. These are the classical triad of Horner syndrome. And next, let's talk about radial nerve injury. Radial nerve injury takes place at three different sites, which are high lesion and at spiral groove of humerus, which is commonly due to mid-shaft fracture of the humerus, and injury to posterior interosseous nerve, PIN in short form. It is a deep motor branch of radial nerve which controls the muscles to extend fingers and thumb. So, when injury takes place at axillary region, it is called as crutch palsy or Saturday palsy, and it is characterized by wrist drop, triceps palsy, and sensory loss of first web space. Here, remember that triceps muscle is affected and it leads to the loss of elbow extension. When injury of radial nerve takes place at spiral groove of humerus, we can see wrist drop but with normal extension and flexion of elbow, because in this case the triceps muscle is not affected. And this picture shows the midshaft fracture of humerus, a most common site of radial nerve injury. And don't get confused between injury of surgical neck and spiral groove of humerus. In case of surgical neck fracture, axillary nerve is injured, and in case of fracture of spiral groove of humerus or mid-shaft fracture, radial nerve is injured. And this picture shows the classical sign of radial nerve injury, which is wrist drop. And when posterior interosseous nerve is injured, it leads to the drop of a finger or thumb, not the wrist. Only finger is dropped. And next, the last nerve injury we have is a median nerve injury. Median nerve injury, it can be caused due to supracondylar fracture of humerus at elbow level and carpal tunnel syndrome at wrist level. And the clinical signs of median nerve injury are hand of benediction and ape's thumb deformity, which looks like this, in which the thumb, index finger, and middle finger are extended while the ring finger and pinky finger are flexed. It only appears when a person tries to make a fist. At rest, it will be normal. And other clinical signs are there is a loss of sensation over lateral three half of fingers on palmar side. And don't get confused between the ulnar nerve damage, which is characterized by claw's hand, and median nerve damage, which is characterized by hand of benediction. In case of claw's hands, the ring and pinky finger are slightly bent, and in case of hand of benediction, they are completely flexed or bent. And with this, we completed our episode 1. As it was a rapid revision series, I'm just hitting the important points and not diving too deep. So, to practice the MCQs on this topic, I dropped the link in the description. Please check the link and try to solve the MCQs. If you like the video, please like, share, and subscribe. Thank you for watching. See you guys in the next episode.